This is Reality Check. I'm Matt.
And I'm Chris. We're two licensed therapists.
And two military veterans.
And we're here to smash societal fantasy
so you can live in reality.
Welcome back to Reality Check.
Today's Reality Check is bipolar is an actual disorder, and you probably don't understand what it actually is.
Right. So, in our circle, doing therapy with clients, we see a lot where, more men to women, men accusing women of being bipolar or being manic or being depressed just for having regular everyday emotions.
Mm-hmm.
And so we're doing this episode to kind of clear the air on, okay, like what is actual mania? What is hypomanic episodes? Like what is depression? And how does that differ from just, oh, I'm sad because my dog died, not because, again, I'm bipolar.
And a lot of guys might think their wife is bipolar because she's sad about her dog dying, which is part of nature. Or maybe she's emotional for any number of reasons, because there's a fact that I think we should bring up. See, the limbic system, which is the emotional part of the brain, it's actually larger in women.
Yeah.
It's kind of amazing, right? Men and women are actually biologically different. They are. Larger limbic system, they feel more emotions. Men's brains are built more to do things in the visuospatial region, which helps you do things like play chess, do Rubik's Cubes, play Risk,
Right.
How many women do you see playing Risk till 2 and 3 in the morning? Occasionally, but generally speaking, they're the men, right? It's not a bad thing that women have more emotions.
Yeah.
So guys need to stop this stuff. So bipolar is not, you're happy, you're sad, you're happy, you're sad. We're going to go through the definition of it. But we got to talk about mood versus affect.
Right.
So a mood, people will say something like, I'm in a bad mood. But that's not actually accurate, is it?
No.
Because that's affect. Affect is, I'm happy right now. Oh, now I'm sad. And so when people have these emotions that fluctuate like that, we actually call that an unstable affect. It's not a mood disorder. Moods are longer. They're at least days, but they're usually weeks to months.
Yeah, so kind of putting in layman's terms, I like to think about it as like affect is like today's weather, where your mood is like a climate. Right?
There you go. That's a good way to put it. So when we first understand bipolar, it's a mood disorder. It's not going to fluctuate, as you say, with the weather. It's going to fluctuate with the climate.
Right.
In fact, some people's bipolar cycles are attuned to weather cycles. It's not that common, but it does happen. I've had clients that fall in that category. So that's the first thing to understand.
Right.
Now, it doesn't mean that you go high to low, high to low, high to low. Now, sometimes it can sort of be that way, but not in rapid succession.
No.
So the diagnostic criteria begins with, and it ends if you don't have this, it begins with having a manic episode. So let's first go into what mania is, and if this is not present that we're going to discuss, this person doesn't have bipolar. And even if you think so, get the person clinically diagnosed or ask them if they want to. Don't push anyone to do it. Before we ever try to decide for someone, we never decide for somebody. I'm a professional at this.
No.
I never decide for somebody. Sitting down with my clients, I never say, hey, this is what you are. We discuss it. And we decide if this is really something relevant and if it's something that's going to contribute to their treatment, but we never push it on anybody. But let's start with that.
Right. So let's do the definition for a manic episode, right? So it's a distinct period of abnormally and persistently elevated, expansive, or irritable mood, and abnormally and persistent increase in activity or energy, lasting at least 1 week and present most of the day, nearly every day. During the period of mood disturbance and increased energy and activity, 3 or more of the following symptoms, 4 if it's only irritability, are present to a significant degree and represent a noticeable change from usual behavior, right? So you got your usual baseline, and then here are the changes, right? Inflated self-esteem or grandiosity. Decreased need for sleep, so feeling rested for only about 3 hours of sleep. More talkative than usual, or more pressure to keep talking. Flight of ideas, or subjective experience that thoughts are racing. Distractibility. attention that is too easily drawn to unimportant or irrelevant external stimuli, right? So basically, to a more significant degree, like huge squirrel moments. Increase in goal-directed activity, either socially, at work, or sexually, or psychomotor agitation, so purposeless, non-goal-directed activity, right? Excessive involvement in activities that have high potential for painful consequences, engaging in unrestrained buying sprees, sexual indiscretion, foolish business investments. But these are the criteria, but we're going to break it down because you can say that anybody's a little bit of these things, but if you've ever sat with a person that's experiencing full-blown mania, it's to the 9th degree.
Think about it. What illicit drug might have some of these symptoms in common?
Oh, cocaine for sure.
Right, so like there are drugs. So if anyone's hearing this and thinking, oh, this doesn't sound so bad, increasing goal-driven activity, I don't need as much sleep, I'm more confident. No, it's not good.
No.
I promise it's not good.
It's not that you have a good business idea, it's you have 50 good business ideas and none of them have any structure, and you're going to the bank and taking out $50,000 loans and investing in like overnight schemes, and like by the time you wake up a week later out of your manic episode, like you're thousands of dollars in debt and you have half a dozen startups that you know nothing about. It's almost a detachment from reality. Like that's how irrational the goal-driven activity is.
It's absolutely a detachment from reality. So you and I have seen a lot of bipolar over the years, real bipolar.
Yeah.
The scenario you described is one of many possible scenarios. Some have sex with a different partner every night, and regardless as if they're in a romantic relationship or not, you're not thinking really straight. The increasing confidence is not a healthy type of confidence. You will do and say things that are absolutely ridiculous. Now, depending on the level of mania, this can get more or less severe, but the increase in dangerous activity is certainly a real thing. You know, I've seen people do things like throw away, paintings worth tens of thousands of dollars, sell their house, in that time. I mean, like I said, have sex with random people, do different drugs, make horrible decisions, and then they come out of their mania, which can take weeks or months sometimes, and then they realize how bad it is. I mean, some people will build an entire deck in 2 or 3 days with all these, oh, that's a great thing. Well, no, not really, because it's actually not constructed very well usually.
No.
And also, maybe you didn't go to work, and maybe you were incredibly rude to your partner, and maybe you were kicking your dog and stuff. Like, it's not a good energy. I worked at a hospital years and years ago, and I worked in intake, and I remember this manic man. He came in, he needed to be there. He took off all of his clothes, and he stood up on the counter and started to preach. That is actually typical behavior for full-blown mania. So when we talk about what bipolar is, and before we start categorizing people as bipolar, we have to understand what it actually is. Now, there's bipolar 1, there's bipolar 2. Bipolar 2 is less severe and usually shorter in duration, but still involves risk, still involves an overconfidence and overspending and over-sexualization. It's just at a smaller degree.
Yeah, hypomania is no joke.
Yeah, it's still very, very, very debilitating. So when you think about it, if you think that your wife, and it could be your husband, it could be your mother, it could be anybody, but I say wife because I've seen this so many times. A couple will come in, and the woman says, he thinks I'm bipolar, or he'll come in and say, well, we're here because she's bipolar. And I'm like, okay, really? Do we really know what bipolar is? And then we get to have a discussion about what it actually is. So, and I'm sure you've seen this many, many times, and even if it's not bipolar, it's the fact that you're using something like bipolar to label, your partner in a way that's not going to be healthy.
No.
And one thing I'll say, this is something that I'm passionate about because I have to deal with it so much. And it's the same kind of pattern. Men oftentimes just don't deal with emotions as well. And we talked about this. Smaller limbic system. The capacity is a little bit less for men than women on average. There are some incredibly emotional men, but on average, far less capable of handling emotion, especially negative emotion. Women handle it better than men. It's a fact. Women handle stress better than men. It's biological fact. And so because of this, a lot of times men, especially very logical men, like to kind of push these women aside, and they don't want to deal with it, and they want to call them unstable, and they want to call them all kinds of things because they often feel superior that they're logical, and they make it seem like the woman is inferior. But you know this because you've seen it too. Here's what can happen. This is a very likely scenario. The woman shuts up. Because she has been devalued. Her emotions don't mean anything. Nothing she says or feels is validated. And so she shuts up for the sake of the marriage. Well, that comes with a price tag. Emotional distance, resentment, feelings of emptiness, inadequacy, being unloved, feeling unloved. So then you have this huge need being unmet that you're dying for and not getting. And so here's what happens. Your toilet breaks. You call the plumber. Plumber comes over. You're gone, but your wife is at home. He's a young, handsome, nice guy who listens to her life and understands it. And next thing you know, they're sleeping in a motel room, and you're like, "What is this? What is going on?" And this is not to say a woman should do this, or a man, or anybody, but this is the kind of thing that happens when you're starved in your relationship. Don't be surprised when your wife ends up in the arms of another man when you have squashed her emotions for all these years, and all she's doing is dying to let you get to know her and connect on a deep emotional level. So the idea is we got to stop with this stuff. If you're a man and you struggle with emotions, okay, welcome to the club. We all have. I didn't begin my marriage with this amazing ability to sit with negative emotion. But I've gained a lot of trust and intimacy and connection with my wife because of the willingness to do so.
I always joke with my guys that come in for couples counseling. I'm like, look, I got out of hanging out with Marines out of the military in 2014. Like, I did not word good, I had to practice. I had to dedicate time to enhancing my emotional color wheel, to being able to say, no, this is not fine, this is not okay, or hey, whatever, do whatever you want, I don't care. Like, no. You actually had to assign a thought or a feeling to everything that comes across your plate. And doing that increases your emotional intelligence. And so that's usually where I start off with couples, but definitely getting away from stuff like bipolar, because then you're just taking somebody's needs and you're othering them.
You know, if it's true bipolar, then let that other person go seek the accurate diagnosis, and then if so, the proper treatment. Because there are treatments available that can be very effective, but to use it as a label, it's just weak. Now, it's not just husband to wife or wife to husband, because it can go the other way. If you have a very logical, kind of go-getter type of woman, you know, what many people would call a type A personality, which isn't exactly accurate, but it's what people say. Then sometimes that construct of a female personality has a harder time with the man that they perceive as weak. And so sometimes you'll see it in that way as well. But not just there, in work situations. If an employee has too many emotions, you might label them as bipolar or something else. OCD is another label, which is not understood very well. But there's one really key thing that you have to understand about this, and it's called clinical significance. A lot of people say, I'm OCD about this thing. Well, no, you're not. Right? You might be obsessive about something, but you're not OCD. OCD is an actual diagnosis that requires clinical significance, which means it's not something you can just manage on a day-to-day basis.
Or another one that we'll get into that I hear several times a day. Hey, I'm addicted to this. I'm addicted to coffee, Like, oh, I'm addicted to this monster. Or, hey, I'm addicted to watching my favorite show. Like, no, you're not, because clinical significance, It exists. It doesn't impair your ability to work or have a social life or function at home. Like, clinical significance is just paramount to any diagnosis.
So, before we start thinking that we have a diagnosis, or especially someone else, let's consider something like clinical significance. Let's take OCD, for example. Well, if you wash your hands obsessively. That might be a problem, it might not. If you function otherwise and it doesn't seem to interfere with anything, it doesn't reach the level of clinical significance. Now,
Right.
if your skin is cracked and bleeding and you're always going to the hospital because you've overwashed them again and now you have to get this treatment, and that could become clinically significant. If you wash your hands so much that maybe you're late for work, or you take breaks that are too long and you get fired from a job, or you freak people out because of how weird this is, well, okay, so now we're reaching that level.
Yes.
If you check your locks 3 times before you go to bed, that doesn't make you OCD. If you check your locks 30 times before you go to bed, maybe.
Yeah.
And if you're late for work because you had to check them 30 more times, then maybe.
If it takes you an hour to even get out of your driveway because you had to check for the 20th time that your stove was on, you have OCD.
So those are the kind of things that you can look at, but that's what it has to reach.
Yeah.
So, again, mood affect.
Mm-hmm.
If your affect changes, what people call mood, when your affect changes, like the weather, okay, you might have unstable mood, but let's not use that as a weapon either.
Exactly.
So if you can't deal with your partner's emotions or your colleague's emotions or classmate or whoever it may be, maybe it's time for you to give yourself a reality check and say to yourself, I need to actually be able to sit with emotions.
Yeah.
And if you can't, you very likely do things like drink and smoke and maybe drugs, or maybe obsessively eat or work out, things that will avoid
Or you're angry or irritable all the time. Because again, you're emotionally constricting. So I like, in any kind of medical intervention, I like path of least resistance, right? So before I write my wife off as bipolar, maybe I start with it saying, am I the problem?
Right.
Because I can be responsible for myself, and I can get myself help and check myself out before I go on to say maybe somebody else is the problem.
And this will lead into another podcast, but each person taking full responsibility. And I'm a big believer in taking as much responsibility as is appropriate and accurate, and not one bit more, not one bit less.
Right.
And us saying this doesn't mean that you then go home and bow down to your wife, right? And then you go and say, well, whatever you want, dear, and then you become totally weak and passive. That's not what this is saying at all, because that's not going to build a healthy relationship. You actually have to be firm. You have to be strong. Strong is attractive. Don't think that weakness is attractive, because it's not. It's another biological thing, but women are attracted to strength and security and things like that.
Yep.
And just people in general are attracted to strength. Weakness is not attractive. So we want to still be strong, but that doesn't mean we hide and call her names, because that's weak. It's weak to hide from emotions. Stand up to them. If I tell men this all the time, learn to sit in negative space. If you feel like your wife is angry, sit in it. If it's probably not about you, because most of the time it isn't. You just can't sit in that negative space. But even if it is, where are you going to run from it? Sit in that space, deal with it, grow from it, and then your relationship grows and you grow, and you don't have to avoid emotions your whole life. It actually, emotions regulate you.
Yep.
And they make you healthy.
Yep.
Hiding from them leads to abuse of alcohol and drugs and other things, because you're just trying to stay away from them, and you're going to occupy yourself, and you're going to chemically make yourself unavailable to those things.
Well, and it leads to something that could be another podcast too, where you stop registering emotions, and then what's a lot of these younger generations famous for? Chasing what feels good, right? Like, not that you're actually emotionally in tune with yourself, you're just doing things that are just temporary, instantaneous pleasure, and you're not actually getting any emotional depth from it, but it feels good.
Guess who else is in tune with what feels good? Lizards?
Yeah.
Crocodiles? Right?
Yeah.
Being connected to what feels good is not difficult.
Right.
All right, that's all for today. Stay tuned for our next series of podcasts, and we will see you next time. Thank you for tuning in to Reality Check. Please like, share, subscribe, and comment below.
And if you know anyone else that could use a reality check, share the link.
See you next time.